Good morning. Myself Urezi Rehana, working as a nursing tutor in Knowledge Institute of Nursing. So, as we have previously seen only congenital heart disease. So, today we will learn about nursing management of the children with congenital heart disease. So, first is nursing management aims at early diagnosis and management of the problems with prevention of complication and genetic counseling. So the main goal of nursing management is firstly we have to do early diagnosis and whatever the problems that are present, so we have to do appropriate management for that problem and prevent the complications. First, in nursing management, we will go for assessment. So, nursing assessment includes a detailed history of present complaints. So, whatever complaints that are present, that we will take history, then history of illness like past history, then present surgical history, past surgical history, whatever history of illness. Then birth history we will take of the child, then family history, then development history. In development history, anthropometric measurement to assess the severity of problems and associated growth failure, measurement of height, weight, head and chest and arm circumference. So we will do all the anthropometric measurement which includes height, weight, head, chest and arm circumference. Then we will also assess the vital signs, that is temperature, pulse, respiration and blood pressure. Then we will assess the oxygen saturation, then skin color, that is whether the skin color is pink, cyanotic or mottled. Okay, so why we are assessing the skin color? So because in classification we have seen that maybe cyanosis is present. Okay, so two classification were there, cyanotic and acyanotic. So to identify which type of congenital heart disease is present, we are assessing the skin color also. Then mucous membrane, whether it is dry or cyanotic. Then peripheral pulse. So in peripheral pulse, we will check the rate, symmetry and quality. Then edema, then capillary refill time. Then cold to touch, clubbing, chest wall deformity, level of activity, consciousness, respiratory pattern, heart sound, feeding behavior, intake and output, and sleeping pattern. So these are all important to plan and implement nursing care. So all these things we have to assess, and whatever the problem identify, for that we have to implement nursing care. Laboratory findings and other investigation reports to be reviewed to identify the problems. We have to also review the laboratory reports and other investigation reports. Then nursing diagnosis. So nursing diagnosis of the congenital heart disease will be like, first is impaired gas exchange related to altered pulmonary blood flow or oxygen deprivation. Then altered cardiac output related to specific anatomic defect, that is whatever defect is present, ASD, VSD, PDA. Then activity intolerance related to decreased oxygenation in blood and tissues. Then altered nutrition less than body requirement related to the excessive energy demand required by increased cardiac workload. Then increased potential for infection related to poor nutritional status, anxiety related to diagnostic procedures and hospitalization, developmental delay related to decreased energy, inadequate nutrition, physical limitations, and social isolation. Then alteration in parenting related to parental perception of the child as vulnerable. So these are the nursing diagnosis of the congenital heart disease. Now nursing intervention. So first, relieve the respiratory distress associated with increased pulmonary blood flow or oxygen deprivation. So because of oxygen deprivation or increased pulmonary blood flow, the patient will suffer from respiratory distress. So we have to relieve the respiratory distress. So we will do following intervention, that is, firstly we have to determine degree of respiratory distress. Then we have to position the child at 45-degree angle to decrease pressure of the viscera on the diaphragm and increase lung volume. So we have to give the child semipolar or polar position. So this will decrease pressure on the viscera of the diaphragm. Then paint diapers loosely and provide loose fitting pajamas for older children. Then feed slowly. That is, the mother has to give breastfeeding to the child slowly. Then tilt infant's head slightly. Then suction the nose and throat if unable to cough out secretions. So if secretions are present, we have to do suctioning either in nose or in throat. Then provide oxygen therapy as needed. Then improve oxygenation that the body functions may be maintained and provide effective oxygen environment. That is, we have to keep the child in environment that is full of ventilation. Then observe response to oxygen therapy. So we have to, after giving oxygen therapy to the child, we have to observe the response of the child. Then observe response to oxygen weaning therapy. Oxygen weaning therapy means after giving any of the oxygen therapy either by mask or ventilators, after some time we have to stop that therapy and then we have to observe the response of the patient. That is called as oxygen weaning therapy. Then relieve hypoxic spells associated with cyanotic types of congenital heart disease. Observe fertile spells, encourage fluid intake, and we have to obtain vital signs. Then next is provide adequate nutritional and fluid intake to maintain the growth and developmental needs of the child. So in uh, sign and symptoms we have seen previously that poor growth will be present. So for that we have to maintain adequate nutrition and fluid intake in this patient. So we will feed the child in semi-erect position. So below the picture it is the this position is called a semi-erect position. Then provide small frequent feedings. That is, we have to give the child feedings, but small and frequently. Then provide foods with high nutritional value. So whatever food we are giving to the child, that should be in high nutritional value. That is rich in protein, vitamins, calcium. Then determine child's likes and dislikes. That is, we have to see what child likes and what child don't like. Then strict input and output chart we have to maintain and daily weight we have to check. Then next is prevent infection. So for preventing infection, we have to prevent exposure to communicable disease. Communicable disease means the disease that can be transmitted from one person to another person. So we have to prevent the child from the exposure of such communicable disease. Then immunization should be up to date. So whatever immunization as per WHO schedule, we have to give vaccines to the child as per the immunization schedule. Then hand washing should be observed. That is, we have to do strictly hand washing before and after contact with the patient. Then be certain that the child receives prophylactic medication for infective endocarditis. That is, antibiotics should be given to the child for preventing infective endocarditis. Then reduce the workload of the heart since decreased activity and expenditure of energy will decrease oxygen requirement. So we have to reduce the workload of the heart because child can't take more, can't do more activity. So if more child is exposed to more activity, then the workload of the heart will increase. So for that we will provide child uninterrupted rest. Then we have to avoid unnecessary activities. Then we have to prevent child from excessive crying. Then we have to provide diversional activities and we have to prevent constipation. Then next is observe child for symptoms of congestive heart failure that occur frequently as complication of congenital heart disease. So in pathophysiology also we have seen in many conditions that the end was with congestive heart failure. So we have to observe the child for the symptoms of congestive heart failure. Then we have to observe for the development of symptoms of infective endocarditis that may occur as a complication of congenital heart disease. Then we have to observe for the development of thrombosis that may occur as a complication of congenital heart disease. So one of the complication of congenital heart disease is thrombosis. So we have to also check for the thrombosis. Then prepare the child for diagnostic and treatment procedures. That is, if surgery is told to do, then we have to prepare the child and parents for the treatment procedures. Then we have to explain cardiac problems to child and parents. Then next is health education. So as a notes, we have to instruct the family in necessary measures to maintain the child's health. That is, whatever the steps further to be taken, for that we have to guide the family. Then teach the family about the defects and its treatment. So whatever type of defect is present, atrial septal defect, patent ductus, arterial, so whatever type of defect is present. So we have to teach the family about the defect. That is, what will be its complication, what will be the sign and symptoms, what will be its treatment. Then encourage the parents and other persons to treat child in a normal manner as possible. So we have to encourage the parents that they should treat their children as in normal manner only, not as an ill child. So this was all about the nursing management of children with congenital heart disease. So I hope that you all understood. So further keep watching my video. Thank you all.